We are here to talk about aging life care professionals and a life care partner and advocate, Dr. Rebecca Montano. Dr. Rebecca Montano is an industry professional. She has over 25 years of experience working with individuals with disabilities, as well as individuals who are experiencing the changes and challenges associated with aging. I think that applies to all of us here. Dr. Montano has a PhD in human services with an emphasis in geriatrics, a master's degree in rehabilitation counseling, as well as a master's degree in business administration. Dr. Montano holds certifications as a certified rehabilitation counselor, a certified case manager, and a care management certification. Dignity, individualism, and preservation of value are the key elements of Dr. Montano's philosophy of working with the aging population. Certificate of completion, basic mediator, California dispute resolution, and certificate of completion, divorce, family and business mediation. She's got lots of experience under her belt. Let's welcome now Dr. Rebecca Montano. Hello, Rebecca. Please unmute yourself.
I always forget to unmute myself. Thank you for that lovely introduction. I hope everybody's doing well today and is healthy and happy. Today we're going to talk about my profession, aging life care managers. I'm going to share my screen with you here and we'll get started. I can't see this. Hold on a second. There we go. Slideshow. From the beginning. All right, so our presentation today is how aging life care managers can be a life care partner and advocate for anyone really at any age of life. I can say right now my youngest client is 50 and my oldest client is a very young age, as she told me this week, of 90. She does not consider herself elderly in any way, shape, or form. She's quite the active lady. So who are we and what do we do? What is an aging life care professional? I have manager on there too, because some of us use professional, some of us use manager as our job title. But typically we're social workers, nurses, gerontologists, or other health or mental health professionals. We have specialized training and in the field, especially around aging, but also many levels of disabilities and different disease types. All of us have various special training, but some of us specialize in certain populations more than others. Most importantly, I think we follow a very strict code of ethics and standards of practice, which we have to review. In fact, I just sent mine last night, every 3 years. So we have to read and take a test of our practices continually. Aging life care managers is unfortunately a private pay situation in most cases. And in San Diego, the hourly fees range from $100 to $250 per hour. Each professional charges differently. I, for example, charge in 6-minute increments. There's others who charge in quarter hours. So it really just depends. And I put that up front because people very often ask that question and want to know, what the status is of that. More importantly, what do we do? And what we do, our main goals with any client, regardless of age or situation, is to provide peace of mind that somebody is there advocating for you, taking care of things, helping out, but most importantly, increasing quality of life for anybody who is facing those challenges and changes associated with aging or any disability or illness that they are experiencing or their family members. So what do we do? How do we help? So our main tasks are providing professional support, monitoring situations, and coordinating care. So I always explain to clients that they have a choice when it comes to Aging Life Care Manager. We can do all of these things, or we can do only one of them and then let you go on your merry way. And then when you need us, you come back. So for example, we can come in and we can take care of any of these professional support items that are listed here, assess needs, develop a care plan, link you to services and resources, engage when there's a crisis or some kind of family conflict that needs to be resolved, provide you as the consumer with a plan, give you lots of resources, and then you could go out on your own and complete those. If you feel that you can't, you don't have the bandwidth to do that because maybe you're still working and this is for a parent, or you just aren't interested in being the caregiver and the care manager, you want to continue to be more of a spouse and let us do the hard work, we are totally happy to do that. And that's when this monitoring and coordinating of care comes in. And so what we do during those things is we make sure that things are running smoothly. So we make changes and adjustments as necessary. We keep everyone informed. We are constantly reevaluating and reorganizing the plan because care plans in reality have very short lifespans simply because any new diagnosis, change of medication, change of situation can send that original care plan a completely different direction. And while we're monitoring that plan, we're also looking for best fits for client situation. We're constantly communicating, and above all, we're advocating and educating. So we're advocating and educating not only the individual in the situation and their family members, but we're also advocating and educating any care providers, whether that's at home, in a community, in a doctor's office, at the pharmacy, you name it. So we are there helping our families and our clients along the way. So these are our areas of expertise. There are 8 areas of expertise, and we are always working alongside our clients to help make decisions and implement plans. We take this as a holistic approach. So the client and the family are always at the center. And we look at various situations going on in that home. This is part of the assessment process, and provide support in any of these 8 areas of expertise. So it might be something as, we might be there to help understand the health diagnosis, provide durable medical equipment for disability. There might be somebody who maybe needs to have their financial powers of attorney taken care of, or they need to have somebody start to do bill pay, so we might go the financial route. Housing is it best for you to stay in your home with support there, assessing the costs of that, making recommendations for home care, safety upgrades, etc. Or we may have to look at housing. Do you need assisted living? Do you need memory care? Is the boarding care work better for you? As care managers, we know what those resources are throughout the community in order to help you. It doesn't mean that there's a one answer for everybody. Sometimes we start one route and then we end up going a different route down the road. Family. So how we work with families is we help with the communication. We help with conflict resolution. We help the client and the family both understand what roles are. And we have assist. I think one of the most important things is we assist the family members being family members. So we help the wife continue to be the wife, or the husband continue to be the husband, and we take on, the heavy work, having daughters or sons continue to be their children instead of the 24-hour-a-day caregiver. So we really do work closely with the families. We do have clients, however, who maybe don't have families, and so we are very adept at then looking at local resources to assist them when we don't have someone else in the circle of support. And so that local resource could be someone within a religious or spiritual community. It could be a really good caregiver that then becomes that person's support for activities of daily living, like you know, dressing, bathing, food, grocery shopping, you name it. So there's lots of different things that we can do there. Is it a daycare situation and a home situation, for example? And then advocacy, again, we're always advocating for our clients, helping them out, helping people understand their situation, making sure that any and all of these other areas are running smoothly and that that person has the support to get through. Legal, that goes into estate planning. Do they have an estate plan? Do they have their powers of attorney? Do they have an advanced health directive? Do they have a do not resuscitate order? Really getting into some of those legal documents that down the road, when a person can't make their own decisions, that all of that is in order so we know who the decision maker is and how that would move forward. And then crisis intervention is kind of the name of our game. We are there for the good times and the bad. And I always say crises do not occur and emergencies do not occur on, you know, a Wednesday at 12 o'clock in the afternoon. So I doubt I'll be interrupted with a crisis while I'm talking to you is what I'm saying. When they occur is Friday at 5 p.m. or in the middle of the night. So as care managers, we are on call 24 hours a day, 7 days a week. When you hire a care manager, you should have a line of support at all times. And that's as simple as picking up the phone and calling in. You may get someone who's on call. It might not be your care manager, but that person on call knows how to get a hold of your care manager and can triage the situation and then determine what is the next step. Or you might get a team member who knows your case and your family situation as closely as your assigned care manager. And I think that is really the peace of mind part of the whole situation in getting a partner and partnering with the care manager, is that you have that support all of the time. So how do you know if you need a care manager? There's lots of reasons why you would want to hire a care manager or aging life care professional. If you are starting to experience memory loss, or your loved one is, if someone that you are working with is refusing help. This is a big one. We see this happen often. I went to do a family assessment this weekend, past weekend on Saturday, and it's a couple, and the mother was had fallen several times, would not get assistance from her children. I went in to talk to her. We had a story that went along with why I was there in order to get her to agree to see me. And one of the first things I noticed was that her toenails were so long, they were starting to curl over or curl under, which is a perfect reason why she's having so many falls. She cannot step and stand properly. So when she's on her feet are hurting so badly from those toenails being so long that she needed assistance. She would not allow, when I spoke with her kids later, they shared with me that she would not allow them to help her. She would not go to nail salon, which they're not going to cut that level of toenail anyway. And that her podiatrist had retired many years previously, and she refused to allow them to help her anymore. So the nice thing is this lady put me to the test, and she said, if you can find a podiatrist to come to my home and take care of my nails, my toenails, you're hired. Well, our appointment was on Saturday, and yesterday she had her toenails cut. She is now being more accepting of services because I proved to her that I could be there. So these are some of the situations that we run into. Other reasons you might need a care manager, or you have family conflict. I always joke that the only time we don't have family conflict is when there is an only child. And even then we sometimes have conflict because there's conflict with the parents, but we don't always agree. As siblings, as parents and children, as nieces to or nephews to aunts and uncles who we might be charged with, they're fighting for their independence. We're trying to assist. So therefore we're there to assist with some of those needs. Again, if you're experiencing crisis after crisis, like the client I described who was having frequent falls, those are crises. It takes one bad fall to break a hip. It takes one bad fall and someone not to see you to, or check in on you to be on the ground for too long. So those types of things are important. And then confusion about options. Nobody gave any of us, except if you studied it, like I did, a book on how to age and how to deal with all the challenges associated with aging. So there is a lot of confusion about aging, and the resources are there. For example, who pays for what, how it gets paid. Medicare just in and of itself is a very confusing process. So in reality, what it comes down to is you want to get an aging life care manager when you see the safety risks going up, or there's an imbalance between safety and autonomy. So we want to always preserve autonomy and allow people to make choices. But when it is the cost of safety, we really want to have somebody step in and assist. So again, here's some more information about needing to have a care professional. I've kind of talked about this a little bit already, but I think the highlights here is when you need someone to come in who's objective and unbiased to help do an assessment. When you as a caregiver or a family member is feeling overwhelmed, you're falling through the cracks, you just need someone to have oversight, any of these things. Really important to have someone come in. We have so many scams and people who are out there right now looking to exploit our aging population. If you are experiencing a family member who's doing that, that is really a great time to reach out to a care professional and see how they can help. And another one of the primary clients that we see are people who have little or no local support. And the reason that our profession is so helpful is that if you do not live near your family member, more than likely there is a care manager who lives near you or lives near that family member who can assist. Many of my clients, their families live on the East Coast. I even have one client whose family lives in another country in Europe. I'm here, boots on the ground, helping with those situations, as are many of my colleagues. And the nice thing about care managers and partnering with us is we know each other and we often refer to one another. In fact, yesterday I got a call from a daughter in the New England area who got my name through one of my colleagues in Boston. And so she and I will be meeting. She's actually flying out here in 2 weeks to visit her mother. And so we're going to have a chat that day and see if it's something that works for her. I refer often to colleagues in other parts of the country as well. So really, we are out there. It's a profession that not a whole lot of people know about. So thank you, Suzanne, for bringing this information to your group and giving them the opportunity to learn about our profession, because we are out there and available to help. So with that said, how do you find one of us? How do you connect with an aging life care manager in your own area or outside of the area across the country in another location? So we are all part of the Aging Life Care Association. There are care managers who are not part of this association, but we find that it is important to be part of this organization for 2 reasons. One, the resources and the education that we continue to gain through the Aging Life Care Association, but also we are required to adhere to those standards of practice and the ethics. And so you as a consumer know that there's someone watching us to make sure that we are doing the right thing professionally and in working with your family members or with you. So here's the website, obviously, for Aging Life Care Association. And on that website is this little magnifying glass and an icon that says, find an aging life care expert. And you just click on that. And once you click on that, it's very easy. You just put in the zip code, the radius of where you would like someone to be found, and it will give you all of the options. And what you want to look for when you're looking for an Aging Life Care Manager, again, is that Aging Life Care Association membership, because of the resources available to us as professionals, but also the standards of practice and ethics. What we are certified in and how we are certified. We do have levels of certified fellows, which are even more experienced care managers. What are our licenses? Do you want a nurse? Do you want a social worker? Do you just want someone who has a lot of experience and is more responsive, for example? So responsiveness and years of experience. Knowledge of the local area, what services they provide, and obviously what their fees are. When I get calls for potential clients, I explain all of this to them, as do many of my colleagues on the phone, as to what my level of expertise is. But one of the things that I feel, and I have also heard from many of my clients and other consumers, is what is their level of responsiveness? How big is their caseload? How many people are on their team? How many years have they been doing this? Because years of experience is going to equal to more knowledge of resources at hand. The responsiveness time is going to assist in those times of crisis. If they have a lot of service products available, for example, if they do safety evaluations and consultations, you're getting a 2-for-1 when they come out to see you. They're not going to come and say, well, I can't do a safety evaluation. I need to refer out to something else. If they have placement services in their bag of tricks, that means they know the local communities in the area. And so they would be able to much more easily help you to identify what the right placement is for you or your loved one if you're moving out of home and into an assisted living or memory community. So those sorts of things are really important to ask. The other thing that I always recommend is, if you can, and it's not always possible because of geographics and time, is that if you are able to meet that care manager in person before you hire them, it is extremely important. And the reason for that is, especially when we are in an ongoing situation with our clients, we are very involved in all of your medical information, your health, your family dynamics, your social information. You need to make sure that you are employing somebody, hiring a care manager who you like, who you trust, who you have some chemistry with. It's almost like, a dating game. You don't want to have the wrong mix because that can delay processes, that can impact how things are done. So I always say, if you can avoid hiring someone over the phone, avoid hiring someone over the phone and meet with them. I think we all, as is happening in this meeting, have become very comfortable with Zoom meetings, for example. If you're looking for somebody across the country and it just is not feasible for you to fly out there and meet them, have a Zoom meeting with them. I think that face-to-face contact when you're trying to hire somebody is extremely important. And ask for references. Ask for references of clients and other professionals and other care managers that might be able to talk to their expertise, their responsiveness, their professionalism, etc. I will tell you though, if they rattle off the names of 3 clients right off the bat, that is a red flag, because we do have to we follow the same HIPAA laws as all of your healthcare providers do. And so we are not allowed to give out any client names or family names unless we have authorization to do so. So when I'm asked for a reference, for example, I will say to them, I need to check with my clients first and see who I could give you. And then I will usually at that point either provide names of either a family member, if someone is available, but I don't, and I will let them know if I cannot identify a client who is not comfortable, it's not because I'm trying to hide something, but it's because I do value privacy and I respect the privacy of my clients, and that is of utmost importance. I'm happy to give the names of any resources that are professional at any time, but clients, again, we have to protect their identities. But at any cost, there are some who love to talk to how much we've helped them. There are 4 accepted certifications for aging life care professionals. We talked about what is their certification. One is a CMC, which is a certified or a care manager certified. This is a certification that requires a certain level of education, bachelor's or higher in the field in a related field to aging, so social work, nursing, or any of the health sciences, or human service sciences as well, social sciences. 2 years of supervised experience by a certified member, and then you have to take a test, and then it's every 3 years you have to recertify and have a certain number of CEUs. CCM is a little bit more complex. You have to have a master's degree, I believe, or higher. You have to have experience, again, 3 years of experience under someone who is certified, and you have to recertify every 5 years through CEUs or retesting. And then there's also the social work certifications. I don't know too much about those two because I have neither of them, but if someone is a social work case manager, those would be those designations. So why is certification important? It provides assurance of our knowledge as a care manager and our professionalism. These certifications also have an additional standard of practice and code of ethics that we have to follow. So someone in our association and or having these certifications is going to assure that you have a professional who is committed to doing things ethically. I ran through this pretty quickly because I always find when I give this, there's a lot of questions, and I wanted to make sure that we had plenty of time for questions and comments, and I can go along back into the slideshow at any time if there's something that somebody wanted to talk about specifically.
Well, thank you very much for that informative presentation. And now we will open it up to questions from everybody.